Hello there. Come on in, come straight in, please. Take a seat for me just there. How are you? Good. My name's Bryony, and I'm going to be examining you today. Just confirm your full name for me. Perfect, thank you. And what's your date of birth? Alright, great. Okay, so please tell me a little bit about what you've been experiencing. What's been going on? Okay. And is this why you've made this appointment? Okay. Okay. So you're feeling a bit fatigued? Okay. Dizziness? Okay. Alright. Okay, no, that's absolutely fine. Okay. So you just feel a bit low mood, fatigued, tired, exhausted, that kind of thing, low energy, and dizziness. Okay. No, that's absolutely fine. You were correct to make an appointment to come see me, so please do not worry. So, there are numerous things that could indicate why you're feeling like this. I can do a few checks today with a few tools that I have. However, I think, just based on what you've told me, I think it would be good to book you in for a blood test the next time you come. Yes. So, I am going to note that. Blood test. So we'll do an FBC, so full blood count, and we'll check your U's and E's. We'll also check for your B12. And have you ever had a blood sugar sort of check? Check to see if you're diabetic? No, okay, we'll do that. HJ1. Okay. And we will test your magnesium and potassium. Okay, just make a note of what tests I'm going to put you down for your blood test. Just because you're feeling a bit low mood and fatigued, I feel like you may have been lacking some nutrients. What's your dietary sort of like? Do you have any dietary requirements? Are you vegan, vegetarian? Okay, do you eat fruits, vegetables? Your nutrition is very important, yes. Okay, and do you have much calcium in your diet? I am going to check your calcium levels as well, actually, in the blood test. Okay, no, that's absolutely fine. I think I have everything here. We will definitely do a blood test for you the next time. I've just put on there everything I want to test within the blood test, alright? But I think what you've said, it's mainly, we'll do a check to make sure, but I think the blood test will tell us a little bit more, and that might be why you might be feeling low mood. Okay, so for today I'm just going to do a cranial nerve examination. I just want to check that the dizziness isn't because of your eyes or your sort of hearing in your ears, because sometimes that can make you feel a bit dizzy with your sinuses. Okay, and regarding your sort of low mood, low energy, I just want to make sure that everything is okay. Alright, so I will be doing that, and obviously checking your blood pressure as well, because that can be a cause for your dizziness. So we'll check all of that, and then we'll book you in for a blood test. Okay? Alright, so regarding sort of your facial nerve, your eyes, your ears, your mouth, your nose, have you been experiencing anything out of the ordinary? Okay. Any pain at all? Do you have any pain? Okay, that's fine. Anything else you think I should know about? Okay. Alright. Well, don't worry, I'm sure everything's fine. The symptoms you've given are quite common, and just based on you and what you've told me, I suspect you might just be lacking something within your blood test, so that should be fine. Okay, what I'm going to do first, I am just going to check your breathing. Okay, so please just take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Okay. I just want you to try and relax, okay? I'm going to be doing a lot of tests, so just try and be relaxed and don't worry. This is just sort of routine checks. Okay. So I'm just going to have a little listen of your chest, just to make sure your heart and your lungs sound okay. So I'm just going to pop that one on there. I'm going to put that one there. Okay. That sounds okay. I'm just going to put this behind your back. That sounds fine. I'm just going to pop that on your front and just take a nice deep breath in. And out. Take a nice deep breath in. And out. Okay, that all sounds fine. There's nothing wrong with your breathing. Your chest sounds nice and clear. Okay, so what I'm going to do now, I'm just going to pop this one on your finger. I just want to check your oxygen saturation levels, okay? So all you need to do is just pop your finger in there for me. That's it. So we want this to be above 96%, so 96% to 100% for your oxygen saturation levels. It would typically be lower if you had any sort of defect, so COPD or asthma. So, oh well, your oxygen saturation levels are 99%, 98%. That's very good. And your heart rate is currently at 75%, so it's absolutely fine. I'm just going to take that one off your finger. Very good. Okay. Next up, I'm just going to check your blood pressure. Okay, so I've got a machine here. And have you ever had your blood pressure checked before? You have, good. Okay, so I'm just going to undo the cuff. And if you could put your arm in there for me, that's it. So it's going to go right at the top of your arm, and where the line is, just there on the tube, that needs to be on the inside of your arm, just running along your main artery. Okay, good. So I'm just going to turn this on now. Okay, so it will make a noise and it's going to inflate, okay, and it will go quite tight, just to pre-warn you, so just keep your arm relaxed down by your side. So just going to start this. There we go, it's going up now. So just relax that arm, okay? Okay. So it's quite tight at the moment. Yes, that's fine. That's fine. Give it a few more seconds and it will deflate. So it's just counting down, it's working out your blood pressure. A normal blood pressure should be about 120 systolic over 80 diastolic, but usually anywhere between 110 to 130 systolic and about 60 to 90 diastolic is generally okay. So your blood pressure is on the lower side. It's 106/83. So your systolic is a little bit low, but you aren't feeling too well. Your pulse is actually 77, so that's accurate to the other one. But you've got a bit of dizziness and you're not feeling yourself, so I'm not too concerned. If it was under 100, I would be a bit more concerned, especially as you've been having some dizzy spells, okay? But that blood pressure is generally okay, alright? So we're going to take this one off. Just take that off your arm. Good. Okay. I'm going to put that in there. Now, I do just want to note that down. So we've done your blood pressure. Do you know your height and your weight by any chance? Or roughly? Thank you. That's great. Okay. Alright. What I'm going to do now, I'm going to begin the main cranial nerve examination. So I've got some gloves here. I'm just going to put these on. Okay. And to begin with, we're just going to do your facial nerve exam. Okay, so I am just going to touch around your face. Just tell me if you feel any pain at all or discomfort or any tightening, okay? I'm just going to check the movement, alright? So we're just going to move that. I'm just going to rub your face. Forehead and your temples. Any pain at all? No? Okay. Just check under your chin and your jaw. Fine. No pain, are you sure? Okay. Feels okay, there's no lumps and bumps. Everything is moving accordingly. While I'm here, I'm just going to feel your ears. And your eyes are fine. Yeah. This is okay. Alright, that all feels fine. Okay. Just move your neck. Just move your face. Good. Okay, that's absolutely fine. I just want to check your movement, okay? Let's just do a smile. And a frown. Good. And a wink. And a wink. And can you move your head from side to side? That's it, move it. And can you move it up and down? Okay. I'm just going to feel your shoulders. Any pain at all? No. Good. Okay. And just smile again. And frown. And wink. And wink. Good. And move your head. Okay, good. That's fine. Alright. What I'm going to do now, I'm going to touch your face with the tip of this, okay, and my finger. Tell me if it's this sharp one or soft of my finger, okay? What I would like you to do is just look straight in my nose, okay? Good. 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 Very good. Okay. And you can feel this? Can you feel that? Can you feel that? Can you feel that? Can you feel that? Good. Can you feel that? Can you feel that? Can you feel that? Okay. Can you feel that? Can you feel that? How about that? Can you feel that? Can you feel that? Can you feel that? Okay. Good. Now your facial nerve is absolutely fine. what I'm going to do now, I'm just going to have a little look into your eyes. Now, I think I'm going to use this one to look in your eyes and this one for you to look at. So we have an orange light and a blue light. Which one do you prefer the look of? I'm going to do the orange one first. Okay, so just look at my nose. I just want to have a little look into your eyes. Good, look at my nose. Very good. Look at my nose. Good, look at my nose. Very good. Eyes look good. Okay, and look at my nose. Just want to check this eye. Very good. I'm going to cover this eye. I just want to have a little look into you. Yeah, it's fine on this side. Just want to have a little look. Okay, could you just look that way for me? Good. Look up. And look down. And look that way. Good, okay. That's it. Keep looking up. That's it, look up. Okay, look down. Look that way. And look that way. Okay. Alright. Could you just look at the light? Look at the light. 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 Okay. Follow this light. Okay. I'm going to try the brighter light, alright? So I'm just going to try this one. Okay. Look at the light. Good. Look at the light. Good. Look at the light. Look at the light. Very good. Look at the light. 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 Okay. Could you just follow this light for me? Follow the light. Very good. Keep following the light. Follow the light. Good. Yeah, your eyes are fine. Your pupil response is great. Very good. Yeah, that's great. Okay. What I would like to do, I would like you to just look here. 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 Perfect. Okay, look here. 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 Good. How many fingers do you see? How many fingers? How many fingers? How many fingers? How many fingers? How many? How many? How many? How many fingers? How many fingers? How many fingers? How many fingers? How many? How many? How many? Okay. Can you see my fingers? Yep, good. Can you see my fingers now? Good. Can you see my fingers now? Good. Can you see my fingers now? Very good. Okay, your eyes are absolutely fine. They're responding perfectly. Okay, what I'm going to do now, I would like you to tell me what colour pen this is. Orange. And what colour pen is this one? Pink. Good. Please follow the orange pen. Follow the orange pen. Follow the orange pen. Very good. Follow the orange pen. Perfect. Okay. Follow the pink pen. Follow the pink pen. Follow the pink pen. Very good. Excellent. Okay. Please could you now read this eye chart for me? So could you tell me what this one is? E, good. This one. L, T, good. Can you read this one? Perfect. And this one? Great. Can you read this one? Good. And this one? Let's get a little bit harder. Can you read this one? Good. And can you read the last one? You did really well there. Okay. What I would like you to do now is just read this one for me. What number do you see? 9. And what number is this one? 5. Good. What number is this? Good. This one? Good. Okay. No, that's absolutely fine. Alright. I'm now going to have a little look into your ears. Okay? Now, you said you had no issues sort of regarding your ears. That's correct, right? No hearing sort of difficulties. Okay. What I'm going to do, I'm just going to look with a bright light into your ears first. Okay. That's fine. On this side. Yep, that looks fine as well. Okay, what I'm going to do, I'm just going to use my otoscope just to have a little bit of a look into your ear. So, just got it here. There we go. Pop that on. Let's have a little look. Okay, your ears look fine. There's a tiny little bit of build up, but I'm not too concerned. I'm just gonna have a little look on this side. Again, with that side, there is a tiny bit of build up. I'm not too concerned though. What I am going to do, I'm just going to whisper in each ear and please tell me, repeat back to me what I say, okay? 1, 8, 5, 7, 4. Perfect. 10, 7, 5, 6, 1. Very good. 8, 21, 7. Good. 165, 4. Perfect. Alright. I'm now just going to have a little look into your nose. So I'm just going to use my bright light. I'm going to have a little look into your nose. So just hold your head up slightly for me. And have you had any difficulty with your sense of smell? Okay. Alright. Okay. Your nose looks fine. What I do have is a little bottle here. I would like you to just give this a smell and tell me what you can smell. What's that? Good, that's great. Well done. You did that one perfectly. I've got another one here. This is slightly different. Just give that a smell. And what's that one? Brilliant, well done. Okay, there's no issues there. Alright. Just have a little look with this light. Just up your nose. Yeah, your nose is fine. Just do this for me. Very good. Yeah, that's all okay. Alright. Now if you could, I'm going to have a little look into your mouth. So please just open your mouth wide. Okay? I just want to have a little look. Good. Lift your tongue for me. Good. And just say, ah. Ah, very good. Okay, that looks fine. I'm just going to use this light. Just open your mouth. Just want to check your tonsils. Okay, that looks okay. I have got a little tool here. I just want to have a little look at your teeth, okay? So I've got a selection of tools and I'm just going to have a little look at your teeth. Don't worry, I'm an expert at this. I'm not going to hurt you at all. So we're going to use this one. Okay, just open your mouth. That's fine. That's all good. Your teeth are all fine. How is your sense of taste? Okay, what I would like you to do is taste these. These are different to the ones you smelt. So I'm just going to put a little bit in here. Okay, and if you just open. Okay. There you go. What's that one? Good, well done. Okay, this one. Okay, open your mouth. And what's that one? Good, well done. Okay, wow, you have done extremely well today. I've checked absolutely everything. Your breathing was fine, your pulse was fine, your heart rate was fine, your blood pressure was fine, your facial nerve is absolutely fine, your eyes, wow, your pupil response was great, your ears are great, you got a tiny little bit of build up, but I'm not too concerned, and your nose is fine, and your mouth is okay, your tonsils are fine, tongue's fine, sense of smell is good, and your taste is good. Okay, so I'm not really too sure why you're feeling a bit low mood, fatigued. The only thing I can think of is whether you're not sort of eating and drinking is what you should be. So what I will do, I'm going to book you in for a blood test, okay? And we're just going to check a few things to make sure your levels haven't dropped. But you will get informed about that. You'll get a letter in the post, okay? But that's everything for today. Everything I've done, you're absolutely fine. I don't think there's anything to be concerned about too much until we get those blood results back, okay? Now, if you do feel worse or your symptoms get worse or new symptoms arise, please do come back and get yourself checked out, okay? Alright. Well, thank you so much for coming to see me. It's been my absolute pleasure. Alright, well, take care. Bye-bye.